Are you choosing sugar-free options to manage your health or blood sugar? A popular sweetener found in many keto and sugar-free products might pose unexpected risks to your brain and blood vessels. Let's explore the latest research. Erythritol is a sugar alcohol widely used as a non-caloric sweetener. It's common in sugar-free snacks, drinks, and gum, often marketed as a healthy alternative for weight loss or blood sugar control. Approved in the U.S. since 2001, it gained popularity among those managing diabetes or watching their carb intake. However, recent studies are raising important questions about its safety. Despite its popularity, concerns about erythritol's potential side effects are growing. New research suggests a link between higher levels of erythritol in the blood and an increased risk of serious vascular issues. This includes a higher risk of blood clotting, heart disease, and stroke. This is particularly relevant for individuals already managing cardiovascular risk factors, like many with diabetes. A recent study presented at the 2025 American Physiology Summit adds crucial evidence. It investigated how erythritol affects brain blood vessel cells in a lab setting. Researchers exposed human brain blood vessel cells to an amount of erythritol similar to that in just one serving of an artificially sweetened drink. The results were concerning. The study found that this level of erythritol significantly increased oxidative stress in the cells. Oxidative stress involves harmful molecules that can damage cells and tissues. Erythritol exposure also reduced the production of nitric oxide. Nitric oxide is vital for blood vessels to relax and maintain healthy blood flow, especially to the brain. Increased oxidative stress and reduced nitric oxide are early indicators of vascular problems. These cellular changes can impair blood flow and potentially contribute to the risk of vascular events like stroke. Experts suggest erythritol may directly interfere with cellular processes needed for healthy blood vessel function. This disruption could explain the observed link to increased vascular risk. Given these findings, experts advise caution regarding erythritol consumption. Limiting or avoiding products containing this sweetener may be prudent, especially for those concerned about heart or brain health. This is particularly important for individuals with existing risk factors for vascular disease, including those with diabetes. Regular consumption could potentially impair blood vessel health over time. What are the alternatives? Experts suggest considering non-caloric sweeteners like stevia and monk fruit extract. These appear to be safer options based on current research, as they haven't shown the same adverse effects on oxidative stress or blood vessel health. Ultimately, reducing overall reliance on sweeteners and focusing on whole, unprocessed foods is the most effective strategy. This approach supports long-term brain and vascular health more comprehensively. Understanding the potential risks of common ingredients is key to informed health choices. If you use erythritol-sweetened products, especially if you have diabetes or heart concerns, it's time to reevaluate. Read labels carefully, consider switching to alternatives like stevia or monk fruit, and discuss these findings with your healthcare provider. Your vascular health is too important to ignore.